Hi, welcome to another knee moment from Knee Fit in 5 and MSM Products. My name is Dr. Matt Lawless.
And I'm Scott Johnson with Physical Therapy. We got an email the other day from a gentleman by the name of Jim. He has torn his ACL and he is trying to rehab for that. So we got him involved in the Knee Fit in 5 program so that he could be prepared for the therapy after his surgery. But his biggest question was graft choice for his ACL. He's doing a lot of research, he's seeing a lot of things out there, and so I thought I would bring that question to you so that you could answer that for Jim.
Well, thanks for writing in, Jim. That is a very good question to be asking, and that's something you should be talking to your surgeon about in addition to doing your own research. There are essentially 4 different kinds of grafts you can use for an ACL reconstruction. The first are called autologous grafts, meaning they come from you. So they take perhaps a hamstring tendon, a patellar tendon, or a quadriceps tendon. So, for instance, a quadriceps tendon, they use the quadriceps as it comes into the kneecap. Take a little piece of the kneecap with the quadriceps tendon, so it has bone on one side, tendon on the other. The other graft that I mentioned was the patellar tendon graft that has bone on one side and the patella connected to the middle part of your patellar tendon, connected to a little piece of bone in your tibia. So you have bone on one side, your patellar tendon running across, and bone on the other side. And the other graft that's autologous, meaning from you, it would be a hamstring. So it's probably more common to use an autologous graft than the other type of graft, and that's the 4th type of graft, and that would be an allograft. An allograft comes from a cadaver, or someone that has passed away and has agreed to be a tissue donor, so their tissues are harvested, and then occasionally those are used as a graft. The literature pretty much shows that most allografts, unless they're prepared in an exact specific way, seem to have a little bit higher failure rate. So if Jim is younger, under 40, under 45, then I would probably steer him away from a cadaver graft. As far as the autologous grafts, then it mostly comes down to surgeon preference. The key with the ACL reconstruction is making sure the tunnels are in the right spot. So when you do an ACL reconstruction, you're drilling a tunnel to where the ACL started on your tibia, another tunnel to where the ACL ended in the femur, and the grafts go in your tunnels. My preference is the patellar tendon, where the bone, like we talked about, bone on both sides. So the bone plugs actually sit in the tunnels, and the bone heals to the bone, and then the graft, the patellar tendon, becomes your ACL graft. The quad tendon is somewhat similar to that. All of them have their advantages and disadvantages. In a pretty healthy guy, all of them are probably reasonable grafts. The issue you get into, speaking of grafts, is hamstrings with smaller people. So a small person, especially females, or a young female, they seem to have a little higher failure rate if you use a hamstring graft. So in someone who is a girl, if you're a smaller girl, if you're a younger girl, probably using a hamstring is not the best idea. And in that case, I would probably steer you towards one of the other autologous ones, patellar tendon or the quad tendon. But in a guy, either one would be reasonable, with pros and cons both ways on all the grafts.
Okay. So Jim, I hope that's helpful. You certainly want to have that conversation with your surgeon, but we hope that this is something that helps you to have a more educated conversation with your surgeon. We know you're already on the Knee Fit in 5 program preoperatively, but make sure that as soon as that surgery's over with, you jump back on that Knee Fit in 5 program and start working on your range of motion and controlling your swelling and eventually getting your strength back. So we wish you the best. Dr. Lawless, thank you. We appreciate your time.
And Jim, the references that I spoke of when are all listed on the Fit in 5 under the science behind why we do what we do.
Good luck, Jim.